Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Polycystic ovarian disease is also called as Steen-Leventhal syndrome. Polycystic ovarian syndrome is a complex Polycystic ovarian disease is also called as Steen-Leventhal system. It is a complex disorder with numerous genetic environmental factors to act, and they contribute to the pathophysiology of the disease. Genes like DENND1A and THADA, that is DEND1A, and TADA gene are responsible. There is excessive production of androgens, mainly from the ovaries or from the adrenals. From the adrenals, they are seen in 50% of patients. Excessive production of androgens, mainly from the ovaries, include whenever there is increased LH, that is hyperinsulinemia, increased testosterone mainly, and increased androstenedione. Excessive production of androgens from adrenals is seen in 50% of females. From adrenals, there will be increased production of dihydroxyepiandrosterone and increased production of dihydroxyepiandrosterone sulfate. Dihydroxyepiandrosterone sulfate is exclusively produced from adrenals. In polycystic ovarian disease, uh, the testosterone levels will be raised, but they are mildly elevated to less than 200 nanogram per deciliter. Measurements of testosterone included in the criteria of polycystic ovarian disease, but measurement of dihydroxyepiandrosterone or dihydroxyepiandrosterone sulfate are not included. Hyperandrogenemia. Hyperandrogenemia is elevated serum levels of androgens is hyperandrogenemia. Hyperandrogenism. In hyperandrogenism, clinical manifestations of increased androgens are seen in hyperandrogenism.
thank you and thank you for watching.